我是任职，这是我的名。我要 share 用的这个我叫 Dr. Robert Ang 哥，是按美國來的哥。了，我要甲你講這個這個咧困的問題哥。所以你咧困哥，恁通常你想叫你困，你邊頭看有咧 snore 無，咧喊無，所以是我的 topic 啦。所以這個歌咱袂使你take this for granted，咱若甲伊講這普通的人用嘅，但係農村人會有嘅歌。所以我要 share 互你呢Dr. Robert Ang 我特別伊按美國來拄出來咧bakasyon ko，來咧赴阮嘅聖公會用嘅 108th anniversary ko。我則係特別 schedule para 我通 interview 伊個，我即陣要 share 這個，我叫伊叫。Hi， 我是 Hilda Ong 哥。我今日我要講嘅我是，可是我本身都我有去 check 咗啦，了早我有去鼻處 check up， 我有去 sleep study test， 了早也侪人咧講我。Hilda， 敢若是你就個創安尼啊？你要咱哋嚟出去買一個CPAP machine啦，無伊個都無欠命，這個這也 modern 咯，或者 machine 也 latest 咯。所以para 我 sure 看我創嘅對唔對。了我是咱啲大家知影，我這個 Hilda Ong Agaran Servicio Lady YouTube channel is very informative， 我互恁知影啥物對，啥物唔對。所以我今日我是叫 Dr. Robert Chan Ang 哥，伊是阮嘅聖公會校友啦，伊是St. Stephen High School alumni 哥，伊是 President ng Northern California Chapter， 伊頂禮拜調工到來菲律賓為着阮嘅聖公會 108th year anniversary。So 我即陣我要甲恁介紹 Dr. Robert Ang。
Thank you for inviting me.
Dr. Ang， kasi 這個也無人。parang imbo咧看講這個 snoring 這個咧喊哦，是這個是這個重要嘅。那你要注意啦。可是像我要去唱歌，了我則一個 senior 咧，伊則我講，敢若你著個唱安尼，逐個人就逐個咧喊，都無需要啊。那你就是安尼，我愛這個解釋吧。可是我本身驗了嗰個，成日我家己去調下嗰個，所以我今日特別 request 我愛你。甲阮 explain 到底是啥物，這個 snoring 是到底有危險，還是無危險，還是有影呐？可是我拄着一個 doctor 有時當甲我講，Hilda，你知影？你若 sleep apnea 這個會 cause early dementia， 我愛問你有影恁捌嘅？有影吧
？So far, snoring is quite common in human beings, no? It's because of our adaptation to being ambulatory with 2 legs and being upright. So, yung anatomy, nani kikang anatomy, kaya pag animals in the animal kingdom is different lah. So, we're more prone. But not all snorers who sleep apnea lah. So in the general population, around 40% of women would snore and 50% of men would snore. But out of that, only 1/4 of women who snores actually have sleep apnea. And they usually come out either because of increased weight gain, pregnancy, or menopause. Okay? And it's most commonly affecting the dream sleep of these patients. Nina si lame naman, no? It's more common. So 40% of the snorers among men actually have clinically significant sleep apnea. So, lana say clinically significant sleep apnea, you say it affected the health, overall health. So it can predispose you to develop several serious illnesses. One of which you have mentioned, dementia. within a sleep apnea 哦，咱咧 sleep 的时阵哦，一个气管完全关起来个关咧。关起来时阵哦，你无空气，所以氧气哦会降低啊，降低哦对咱的脑细胞哦无好 ，especially during sleep。kasi咱的 brain cells 哦 we use it throughout the day almost constantly, and it needs to rest as well, no? Although it's still very active in different parts of the brain during sleep, but part of it is it requires oxygen so that you can fully recover, okay, from a whole day's work, okay? And so it cause dementia in with brain cells, so especially the chipohun, the lanchitapohun, langkyo temporal area where memory is involved is very susceptible to oxygen deprivation. Okay? So, lange kagaw buikidit. So, it does cause that and is associated with dementia, both senile dementia and even Alzheimer's dementia. And it can also affect your other parts of your health.
At yun lang simle.
So, it has been shown that it can cause cardiac arrhythmia, no? So sim lang potong normal to see sun tiao ma. And it works 24 hours a day whether you wake or sleep. And it beats regularly, around 50 to 90 beats per minute. If you're a little anxious or you exercise, it goes up to even 100 or more. Pero di na sleep apnea ya stressful kasi lane lo kamkak tyo kanan emergency ko. It's an emergency situation because di bo kongki di KDA hui po di kam yung kongki yongki ya. So it looks at it as if it's an urgent problem. So it will arouse you during sleep, but during the arousal your stress hormone like catecholamines, adrenaline, epinephrine, why? Hudyan kan siyang kikiya. Siyang kikiya si Chue, ito di simtiao, irregular. So as you grow older and we grow, our heart is more susceptible to different problems. So if you have sleep apnea on top of it, then it can cause irregular heartbeat. The most common is atrial fibrillation. Yung talaga irregular heartbeat ko. Bo pattern Yage o chinhuiyam yung form blood clot na and it can go to your brain and cause stroke suddenly. Okay. Other than that, it also predispose you to coronary artery disease or heart attack.
At kana sige sleep study ko. Kana ina si under pulmonary department
Actually, originally, sleep medicine started from neurology, field of neurology. Ine-diagnose ka na, walang sleep chin disturbed la. And then they found the correlation between snoring and sleep apnea. And then they found that during their sleep, these patients who are snorer would stop breathing, or their breathing would decrease significantly to the extent that oxygen would drop. So, and then it will cause arousal so that you won't die during sleep, no? It will cause frequent arousal. We call it mini arousals. Kasi it only lasts for 3 to 10 seconds. Okay? And when the arousal occurs, your sleep is disturbed. And so when you wake up, you're not refreshed. You feel tired. Because instead of sleeping through the night, and going into deep sleep and getting enough dream ko, le zuo mong. So lang kila si chuo boy refresh la boy kamkak se lang kung kau ga kanan yako icon la.
Kada din dali
Asi Asian.
Din dali ko di talaga ti uhang bin asi bohang bin na.
Normally lan ti uhang bin na. So normally yung there are 4 stages of sleep la. So first stage of sleep you see between arousal and sleep na. It's a little bit kun ko. It's the lightest stage of sleep la. And then di na monitor the sleep study gunit sa how much percentage of time you spent in stage 1 sleep. The second is stage 2 sleep. So medyo mas stable na yung sleep. So normally after stage 2, you go to deep sleep. When you go to deep sleep, then you know you are recovering a lot of your brain function, including memory storage na. So hindi na-cam deep sleep po, the memory affected yo. And deep sleep is mostly inhibited when you have sleep apnea. So you can see the reason why people may be predisposed to dementia. And then dream sleep, 就是咱咧做梦個，做夢也是有些 certain percentage 啦。So usually around 25%. Okay? And so di na cam dream sleep, it has affected the memory.
No.
Okay.
有早用嘅咧，假使也最有咧甲我講過，因通常2、3點起來袂困入咯。嗰時也是 part 能有medyo咧保護些落埋啲嘅。
你那
困嘅點啫？
就是你那咧困哦，即大家起來個regularly and you're not. It's not because you're jet lagged. You traveled from different places. Normally, let's say you reside or lives in the Philippines, and you're not traveling, and yet you always wake up. Then you have to find out the cause why you wake up. It could be due to sleep apnea or any other factors that can disturb your sleep. So it's into factors. And in order for you to have a good night's sleep, refreshing sleep, so that you feel fully recovered and energized the following day, you really need to find out what's the cause of that awakening in the middle of the night. So, kana na tiong yawa, in we di na kunbo ho, your sleep health, your health will be affected. Okay? So, all of us, whether you're young and old, need a healthy sleep so that you have adequate second stage of sleep, third stage of sleep, which is deep sleep and dream sleep, and that there's no frequent arousals. Then your body function will be really excellent, lah. Okay.
Adiyo le yung hindi kong na thông常一個人就困8點鐘，pero si tigwa parang iyakan ko te ge 8，我當6 to 6.5，我已經有生活咯，係係有關係啲吧？
有關係。So one of the problem with health associated with sleep disorder is sleep inefficiency or insufficiency. So inefficient, you see, di bo tuloy-tuloy sleep ko. And then sleep insufficient sleep syndrome, you see, di kaya hours of sleep ko. So we need a minimum of 5 hours.
5 hours.
So that we can function normally and we are not in great danger of accidents. And then as we grow older, our total sleep time, which is normally between 7 to 8 hours. But as we grow older, that total sleep time can be reduced significantly to 5 to 6 hours. So normally, if you can sleep throughout the night for at least 6 to 7 hours, you're good. You'll be good. But there are some people who are not affected by short sleep. You know, like President Trump in USA, he only sleeps for 4 hours. And it's sufficient for him. Go to in-law, natay kun 4點鐘、3點鐘okay na siya. Kaya dito, out dito, buhay ay kun. Ako siya energetic.
Pero epo ibolay na.
Genetic ka. 10% of the population has that. Okay? So, chinchuwi, sleep medicine.
Di kasi, pero ibo suyaw, imbole na, ekon epo, siesta.
Bo. Talaga genetic, iboy kamkak, sleep insufficiency. Chinchuwi.
Diyo ta sige yung eko, kana silang lang ko, di ba, lang les nor na ni Hua, pero kana lang na mtsa iya, tiyo tanda ka lang nige di partner lo, asi di roommate lo, tsali ka di ko, dili ko niya tsana, kana lang kay kina iboy tsa iya.
Ini normally lan na the key stage to sleep, lan ka unconscious ko, saan lan perception of what's happening in our environment. and perception of the sound of snoring is greatly diminished. So normally you're not aware that you're a snorer or you have sleep apnea. It's usually the spouse, as you said, who will notice that because their sleep is disturbed by your loud snoring. And then, so if your spouse witness your snoring, loud snoring or snort, arousal and your sleep apnea episode, that is already a big hint that you have sleep apnea. So normally, if you may, 我用 demonstrate 個，所以你那咧 snore 開始就是吹聲，即大聲，然後再 loud snort 個。Okay, so normally 就是安尼啊。有隻聽個，呢個就是 apnea 咯。有隻忽然間咯，你 arousal 咯，會真大聲安尼，安尼起來。所以 disturb 你嘅 bed partner or your spouse 個，你 wife or your husband。所以 normally 就是 will who had witnessed your abnormal sleep pattern and disturbance, I 叫你去 sleep study， 還是去看醫生。
你還有衝啦？
袂曉啲啦。我是因為聽到安尼啊，也想聽到。
你解一對啦。
是安尼啦，安尼。所以個 mismo you're clinching the diagnosis clinically. That's already the diagnosis 啦。So 我那有朋友我那看佢安尼，我知伊有 sleep apnea。So Nina said, do you really need a diagnostic test? Well, for the diagnosis, yes, you don't. Because it's already witnessed, but you have to convince the patient. Okay? So, the husband na snort, iboy siyang sindi kasi he is not aware that he snores every night or he has apneic episodes. He is not aware. He may be aware that he may have some sleep disturbance kasi daytime he may be, sleepy. Feel very tired, very sleepy at certain time of the day, and uncontrollable. He will go into sleep. Okay, maybe even in the meeting, suddenly he falls asleep. Okay, so you say the President Biden, he will sleep apnea. So the meeting is during meeting he would actually fall asleep.
親像用嘅你哋安排你困過安尼你納落個，通常像我若出去是早起，去啊到暗暝，了再去啊也做搭個 in between 咯，我安排大家會困去啦，所以也是無好啲吧。
冇多啦，nap actually is healthy for older people, and they should sleep. They can take naps kasi we have shorter sleep time, no? Like 5, 6, 7, 8 hours, less than 7 hours, and that's, as I said, typically it occurs in elderly patients. So to kind of compensate, you can take a nap for maybe 15, 20, 30, or even 1 hour. The problem is if they take naps and they still have snoring and sleep apnea associated with disturbed sleep, then they may not still feel very refreshed. But some of them, they're very refreshing because when they go to sleep during, when they're sitting down and they're in the vehicle, the apneic episodes are less kasi they're upright, they're not lying down. So some of them feel very refreshed from their nap. Because they're sitting up and then they just fall asleep.
Okay. Really, atin chu da zai di ba to song in mo be song sing gong na in country le gong ile snore. Adiao sige na le kun ko tiao he u quan he bo a. Kaya din ito dele gong kasi ko boy kun lit. Tapos diao za chi chu ta ge a si kya hua chu ki le kwa either like kwa ay social media ay news lo as in tele ay drama lo dia cha it's a tele ko boy kun di kun na ka with it tiempo di tem yako chi pala 那饲了了個，那困去也人啊，你去了咯。迄個狗早起那困起個，伊人talaga ay無好勢啊。
Ikaw bo, kanan you feel fatigued and tired, and instead of feeling refreshed. One of the main functions of sleep is to restore your normal function of your brain and your body, you know, so that you're prepared for the next day. And so, di na you disturb sleep, you're not refreshed from your sleep, then there's something abnormal going on. Ngayon, di na lehua, sa sleep apnea witnessed by your husband or wife or your bed partner, di to convince sige pasyente say talaga sleep apnea. So as the spouse, you can take video using just your cell phone, you know, and record it and show it to him or her. Now, in a convince, then you can actually proceed to auto CPAP treatment lah. Tansi, there is a caveat for that because there's a risk that he may be suboptimally treated with auto CPAP lah, which we will talk about it later. Ngayon, Chwete ho, si talaga ikiche isang sleep specialist, and then he or she may advise you to do a sleep study. Formal sleep study, either at home or preferably a complete sleep study, which means you go to the sleep lab. They call it lab, no? Because they're monitoring your sleep. But actually, you go to a bedroom, and usually it's furnished with a nice bed and nice furniture to make you feel comfortable as if you're sleeping in your own bedroom or in a hotel setting. So hopefully those factors, external factors, are diminished, no? When we let you go to a sleep lab to have yourself studied. You know? Now, that one, the result will be shown to the patient, including the one if it's done at home, no? And they will see it so that they will be convinced that they have this problem. Kasi Chintiong Yao, in CPAP is the CPAP, continuous positive airway pressure. Kasi yung chikwan positive yali ko to keep your airway open when you sleep so that it will not collapse or close. Kasi that's what happens during sleep apnea. So, higeo, biyang hige insisting kantan na, uwe lang be comfortable ko. So, unless they're convinced, they're not gonna try it. They'll feel very uncomfortable. And they may buy it and then they're not using it, you know. So, if that's the case, then why even do the study? Why even diagnose or treat, di ba? Mieno, tansak. But there are different treatment options which we can discuss later. So, 真重要就是說to convince個pasyente say真重要say i talaga有sleep apnea. Inabo convince he's not be compliant or open to various treatment options to take care of the apnea.
Kahit na kasi通常ko我係朋友是通常伊會看手咧買互伊個。了解啦，伊個看手看咗用頭一暗，所以無必用咯。
就是啊，因為因是真貴 it's not always comfortable for everyone. So, you know, imagine your sleep is already disturbed and now you have to wear, let's say, a nasal mask, nose mask, or a full face mask para di wala yung machine na. And that's something expected that the patient needs to adjust and adapt in order to tolerate it. Okay? So, first of all, it's being done to convince either the insurance who will pay for it, but here in the Philippines, you usually pay for yourself, right? All the expenses. So, you have to be convinced first that it's worth doing it. In sleep apnea associated with heart attacks, premature heart attacks, irregular rhythm, high blood pressure, especially in children, no? Kana pa itong develop hypertension, din tiyo, because the most common cause of that is sleep apnea.
Gina, ulo ba?
Oh. Uwi gina to ulo.
Pero gina na sleep apnea, iya si ihungadin ba? Si Boa?
Boto ato.
Oh, bichungan sa iya.
So, dito monitor ko. Dito monitor. So, di na monitor, apnea monitor, tsuaylo yung di sa apnea monitor, yung sui monitor, le kwa baby video, itsanya la. Uwe si oxygen lang ko, takon oxygen, drop ko. Now they go to sleep, formal sleep study. Diao si ani no, utunin ani jerk etching ko, yasyong ko throughout the sleep. Then you have to be concerned that there may be other sleep disorder. And one of the cause of that could be sleep apnea, or it could be jerks, myoclonic jerks, or something like that.
Adiyaw, sige ko, di ka ko, parang bigla ulit yung kakun ba? Iya si part ng sleep apnea, di ba?
No, not necessarily.
Tapos di ka minsan itiyaw.
Minsan itiyaw, si reaction to the arousal after you have an apnea episode. So, di ka na siya, you want to survive, kanan di buwan ng hokip, siya di team, di anong gagawin mo? Di chew it, tintang, kait, tintang. Pero, ulyong what, pag-cause for katitire, tintang na, yun ko siya periodic limb disorder of sleep. Yung kasi wito, kulang ang iron body stores. And you do a serum ferritin in the blood test, and you'll know. If it's less than 50, you need more iron. And we take care of it most of the time. But that's another type of sleep disorder. And it can be associated with sleep apnea. So you can have two sleep disorders at the same time. So if you only treat sleep apnea and you don't treat the periodic limb disorder of sleep, then your sleep is still going to be disturbed. Because the periodic limb disorder of sleep, you keep kicking, and you're not aware of it, but your sleep, you can't go to deep sleep because it's kicking all the time. You're not completely relaxed. So it disturbs your sleep, so your health will be affected too. And the quality of sleep is also affected.
At chuchulan si Chun, iki sleep study lo, asi, sa iya ko talaga, kun mo ihose lo, ta ikong sa DC na titiam laile, so ikang yasien, bawat ang boy focus, asi tao yatang. So na si Ani, in talaga tiyo, that's what ako is talaga o sleep apnea.
Yeah. Boto-ato la si ina si loud snorer, and then meron siyang snore arousal, no? Yung hudang ka, ani kila yo. Asi talaga witness apnea, si kanchu bo si yung ang kwa kise 저게 bed partner lekun si hudang kan boleh hokip pa. Ikihateo no chwateo. So yung if it's associated with that, we know they have sleep apnea. But there are other causes of being tired and sleepy during the day, most frequently because there is underlying sleep disorder. There are so many kinds of disorder in sleep apnea lang ko. One I just mentioned, but there are so many kinds. There are at least 80 plus types of sleep disorders. I'm a sleep specialist, so we have to study all of them. So chintong ya, di na kamkak di sleep bo refreshing, non-restorative sleep. You should consult a sleep specialist. Lan chita yan si Philippine, I think there's several sleep specialists in different hospitals ko. I think Chinese General have, Makati has, St. Luke's has. UST, they have it too.
Medical City.
Yeah, Medical City try. So, they are now available. The thing is that not all treatment options are available here.
Dr. Robert Ang, yung so far lang na kang ko, so ay chun kwa wala ni kang sige topic ko, di siya may advice ho ina para lang convince di na siya si ules nor dito tsui.
So, the most common symptoms of sleep apnea, especially those clinically significant, with clinical significance, that means it can affect your overall health in due time, is that you have non-refreshing sleep when you wake up. You don't feel restored from your sleep. During the daytime, you're sleepy. We call it excessive daytime sleepiness. you lose your ability to concentrate and focus. Your memory may be somewhat impaired over time. So you realize that it takes you time to remember things, especially names and places and time. So, dry symptoms dito, you have to suspect you might have sleep disorder, some kind of sleep disorder, and it could be sleep apnea. Now, obviously, the others are witnessed by the spouse, the loud snoring, the snore arousals, the actual apneic episodes, okay? So those are symptoms. And then if you develop some medical conditions, like you're gaining weight, and you can't do anything about it. You just keep gaining weight, and you're trying to lose weight, and you cannot fight it. Because during sleep, stress, because of the sleep apnea, your body is stressed, and it will release stress hormone like cortisol, no? And it makes you increase your appetite and gain weight over time. So, and then, yung mga lung atresia, heart conditions like arrhythmia, as I said, atrial fibrillation, patient who had stroke, patient who had high blood pressure, and uncontrolled, even though they're already on 2 or 3 medicines. You have to suspect, because that's not being treated. One of the causes is sleep disorder and sleep apnea. So if that's not being treated, you just being prescribed medications, don't expect that medications will be able to control your hypertension. So uncontrolled hypertension in children, okay? The most common cause is sleep apnea. Yaxiao dian pa, sometimes 10 years old pa lang, meron ng high blood. Imagine that. Okay? So those are the most common. Okay? And so it's important to know this, so that once you suspect it, you should consult a sleep specialist.